Dr. Jaffe, where and when does the LRA testing fit into a Lyme disease protocol? And what specific benefits can you tell us about adding this in the protocol?
Well, when I hear Lyme disease protocol, what I hear is a deep infection inside cells that shouldn't be there. And what could you do in regard to the immune defense and repair system, in regard to the neurochemistry and hormonal system, in regard to the digestive system, that play, all of which play independent and interdependent roles in regard to whether you as an individual, what we would call a host, are hospitable, if exposed, to this family of organisms. We used to talk about Babesia, Ehrlichia, and each year or two we add another family of infectious agents. But what they all have in common is, in essence, the barn door of our cells are open, and when exposed, they come in and they stay inside. In this case, the barn and the cell are analogous. They stay inside the cell, and they're able to be a parasite. They're able to take the energy and vitality of the cell and divert it to their own purposes. So where do we come in? Well, we come in upstream at the cause. Because if you're eating foods that you can digest, assimilate, and eliminate without immune burden, now your immune system can get back to doing repair. Your immune system can now identify these as foreign agents. They are foreign, and the body should recognize anything foreign and recycle it. We have this remarkable recycling system inside healthy cells, those cells that are electively in protective mode. They have enough of the better nutrients, the essential nutrients. They don't have too much of distress and too much of toxin overload. They're in elective protective mode, which means no Lyme syndrome, no prion disease, no giardia, no recurrent parasite. There are so many signs of people being in impaired elective, they're not in elective protective mode, they're in survival mode. They're just surviving. And we want to help them rehabilitate back into elective protective mode. And so we do not have an anti-Lyme protocol. We do not fight with any of these invasive infectious organisms. We strengthen the individual so that the host is now able to identify them as foreign, put them in the lysosomal recycling center, break them down to their building blocks, and make use of those building blocks to rebuild the cell. So rather than focus on the consequence, which is the infection called Lyme's syndrome or Lyme's disease, with all the consequences of long-term therapy, because sometimes colleagues recommend 3, 6, 9, 12 months of antibiotics to try and rid the body of this invader. And I'm saying you're going to impair digestion substantially if you do that, that is being done as a standard of care. And very often people do not rehabilitate their digestive tract after the antibiotics are discontinued. And then if you look carefully, it turns out very often these organisms are smart enough that they become resistant to the antibiotics. And then some colleagues, infectious disease experts as they are, recommend multi-antibiotic therapy to overcome the resistance of the organism. And thus far, last time I checked, the organisms were becoming resistant faster than we had new anti-infectious, anti-Lyme antibiotic therapies. So look at the host, strengthen the host, look at the cause, follow our approach, starting with the LRA tests, but maybe even including the other predictive biomarkers. Look at self-assessments so that you can help people gain hope and help to climb out of the chronic disease category that we call survival mode and back into where they deserve to be, in the healthy, elective, protective. I'm thriving and grateful to be alive mode. That's what we recommend.